Financial incentives for weight loss, a proposal for a healthier Australia. Why should we have financial incentives for weight loss? Obesity has now overtaken smoking as Australia's greatest preventable risk factor. The election provides a unique opportunity for change and a paradigm shift. To date, there have been many talkfests and white papers on obesity, and yet no change to society's increasing girth. Our nation and our children are getting bigger. There are now more overweight Australians than healthy weight Australians. Overweight is the new norm. The Measure Up campaign. The Measure Up campaign, part of the government's $500 million Better Health initiative, may have successfully raised awareness and knowledge about improving lifestyle factors, but obesity keeps rising. Awareness precedes action, but an incentive can provide a spark. Governments believe financial incentives can make some people act. Prime Minister Gillard launched a $2,000 old car rebate scheme to provide a financial incentive for people to trade in their old cars on more fuel-efficient cars. Of course, qualifying car owners only get the incentive if they take action. The government has pledged to do this for 200,000 vehicles at a cost of $394 million. Financial incentives to lose weight. A similar financial incentive could be given to overweight and obese people who reduce their weight or reduce their waist to a healthy range regardless of where or how they achieve this. Who can provide health services in Australia? The current health delivery paradigm is that all health delivery must be through approved healthcare providers, doctors, dietitians, exercise physiologists, psychologists, etc., regardless of the outcome. Forcing otherwise healthy, overweight people through only these services is inaccessible, unaffordable, and overkill, when the majority simply need a lasting lifestyle change program that brings about eating less and moving more. The weight loss and fitness industries can help reduce the problem. There is a difference between knowing and doing. School books are not effective without school teachers. That's why there are commercial weight loss and fitness providers that have a range of affordable support and coaching options. To date, there has been virtually no government recognition of the role of the commercial fitness and weight loss industries have to play for a majority of overweight but otherwise healthy people. Governments subsidise business. In 2004, the federal government provided $440 million in subsidies to sugar farmers. If the government can provide subsidies to the sugar industry and financial incentives to people for trading in their old cars for new cars, why not provide financial incentives to overweight people to achieve a healthy weight and to maintain it? This is not an industry subsidy, it's a financial incentive to people to take action to improve their own health. How might it work? Their family doctor could be involved at the start, the middle and the end of the program. At the start, participants are measured and screened by their doctor to ensure there is no reason not to take a lifestyle, diet and exercise approach to weight loss. This screening and weight waist measuring procedure could also be done by a nurse practitioner or a Fitness Australia registered fitness leader. A standard screening questionnaire could be used to identify at-risk individuals who need to see a doctor. When they have dropped to their target weight or waist circumference, they return to the measurer for a follow-up. They get a certificate for an initial 33% incentive payment from the government. The payment could be processed by local Medicare office. They get to keep their stamped health rewards certificate for a job well done. What about keeping the weight off? 12 months later, if they've maintained their new weight or waist measurement, they go back to the doctor or approved measurer for the balance 66% rebate certificate. So that's 1/3 for losing the weight, but double the amount, 2/3, for keeping it off. This is designed to promote lasting lifestyle change and not just quick fix approaches. What will it cost? Except for the measurement visits, there is little cost to the government unless the person achieves their healthy weight waste goal. Many weight loss and registered fitness professionals may be happy to do this measurement at no cost. Someone who does not achieve their initial weight waste goal won't cost the government for the incentive payment, nor the cost of the second or third doctor visit. No approved providers needed. The incentive is based on the result, and not the process, and not the provider. It would not matter if the person achieved this on their own, through a community group, with professional advice of a registered practicing dietitian, a personal trainer, gym or commercial weight loss program, regardless of how it's delivered, in a centre, a community centre, a pharmacy or online. There are flow-on benefits. If successful, this scheme would have flow-on personal, family and community benefits, decreasing diabetes, heart disease, high blood pressure and all obesity-affected cancers and diseases. It would reduce demand for hospital beds. It would also decrease absenteeism and increase productivity in the workplace. What about promotion costs? Not all Medicare benefits have a large promotional budget. Many health initiatives have a large budget as they are trying to influence people who are unaware or unconcerned, like the National AIDS campaign with the Grim Reaper, national drug campaigns with the body bag TV ads, the National Terrorist campaign saying, "Be aware, not alarmed." Now let's look at the stages of change so that we can understand who this is targeted at. So, who may be responsive to an incentive? Firstly, there are those in pre-contemplation who are unaware that they're carrying extra weight and unconcerned and unlikely to be influenced by the incentive. There are those in contemplation who are aware and may be influenced by the incentive. There are those in preparation who are researching and may be influenced by the incentive. Those taking action, joining a program, going on a diet, starting exercise, etc. And then maintenance, which requires perseverance and may involve relapse, and these people as well may benefit from an incentive. And finally, there are those who are at completion, which means they've adopted the new behavior, they have controlled their weight. Obviously, the incentive does not apply to them. Let's look at the Measure Up campaign. What does the Measure Up campaign focus on? The Measure Up campaign aims to raise appreciation of why people need to change their lifestyle and includes supporting information on what to do and how to do it. What are the objectives of the campaign? The short-term objectives for the first phase of the campaign are to increase awareness of the link between chronic disease and lifestyle risk factors such as poor nutrition, physical inactivity and unhealthy weight, and to raise appreciation of why lifestyle change should be an urgent priority. To generate more positive attitudes towards achieving recommended changes in healthy eating, physical activity and healthy weight, and to generate confidence in achieving the desired change and appreciation of the significant benefits of achieving these changes. The long-term objectives of the campaign are to encourage Australians to make and sustain to their behaviour, such as increased physical activity, healthier eating behaviours towards recommended levels, and to thereby contribute to reducing morbidity and mortality due to lifestyle-related chronic disease in Australian adults. Now, in summary, unlike the Measure Up campaign, Aussie weight loss incentives targets those in contemplation, preparation, action or maintenance, as it requires a large promotion budget to include pre-contemplators, and that is better addressed by the Measure Up campaign. So the people in the blue category who are aware and may be influenced by the incentives, or in preparation, action or maintenance. So it's a low-cost promotion using PR and the media, social media, Facebook, Twitter, and offline posters and flyers and online websites through Medicare, through medical centres, through hospitals, community centres, fitness clubs, and weight loss centres and programs. Now, children are affected by our increasing obesity amongst adults because they're increasing their weight as well. And most importantly, healthy weight, active parents are an important step to reducing childhood obesity. But many people say overweight people should already have a personal incentive to lose weight. Taxpayer money should not be used for this. However, taxpayers and all citizens are currently paying the cost of increasing public health care, greater demand on the PBS, the Pharmaceutical Benefit Scheme, increased demand for hospital beds and services, and obesity-related disability costs. We are all paying anyway. Is this an obesity solution? There is more to fighting obesity than just financial incentives, but financial incentives may help. Unlike other community awareness interventions that have a large cost whether they work or not, with financial weight loss incentives, if they don't work, if the person doesn't lose weight and keep it off, no incentives are paid. And there's a healthy economic stimulus involved. It would provide an economic stimulus to the fitness and weight loss industries that are virtually ignored by governments for their contribution to the nation's health. There is currently no mention of any commercial weight loss programs on www.measurup.gov.au. And this is a positive policy. Incentivizing weight loss is positive policy compared to taxing junk food. The proposal is inherently simple and motivating for individuals, companies, employers, and communities. Employers benefit from a healthy workforce, and they may choose to match the incentive payment or at least promote it. 1 million Australians taking action. There are approximately 1,200 Fitness Australia registered fitness centres and many more weight loss businesses in Australia. If the average fitness centre has 900 members, that's over 1 million members. Added to this are the hundreds of thousands enrolled in commercial weight loss programs. These people are taking action to achieve a healthy weight and maintain enough physical activity to optimise their health. So how did the idea start? Jamie Hayes, that's myself, Managing Director of Health Inspirations, was listening to the Health Report broadcast last Monday, the 26th of July, on the ABC Radio National show. Host Norman Swan asked listeners to submit ideas about health policy ideas and the upcoming election. By the end of the day, Jamie hatched the idea, called dietitian Matt O'Neill from Smart Shape Centre for Weight Management, and they named the idea Aussie Weight Loss Incentives. Is the concept of financial incentives for weight loss new? No. It's been used successfully in different countries and by companies for their employees and for commercial fitness and weight loss programs. Aussie Weight Loss Incentives ask anyone who knows or finds additional research on weight loss incentives, positive or negative outcomes, to post it on the Aussie Weight Loss Incentives Facebook page. Where can we find out more and get involved? Number 1, register on the Aussie Weight Loss Incentives Facebook page. Download the discussion document and media release. Send them to your local member of Parliament. Share this message with your friends and contacts. Tell them anyone who would be interested or should be interested. Post your support and ideas on the Facebook page. That's what it looks like. So click the link below and you'll be part of the movement. Thank you for your participation.